Good morning from Central Park in the 20th annual Parkinson's Unity Walk. I'm joined here by Dr. Cynthia Fox, LSVT Global. You are the co-founder of LSVT Global.
That's correct.
Can you tell me a little bit about your involvement here with the Parkinson's Unity Walk?
Sure. We've been involved in the walk for many, many years. It's one of our favorite events to do. And our organization works on speech therapy or physical and occupational therapies specifically designed and researched for people with Parkinson's disease.
Great. Now, what are the common speech problems that you see in Parkinson's disease and some classic symptoms?
So at least 89% of people with Parkinson's will have a speech problem. So it's a very prevalent and actually early symptom that can happen. The most common changes early on is the voice gets soft. Monotone, so it loses that inflection, and imprecise articulation. So the voice gets softer, it's harder for people to hear them. People often ask people, what did you say? I can't hear you.
Now, why is that exactly?
It's a great question.
Yeah.
Our understanding today of why the speech problem occurs is a part of the challenges with Parkinson's. So everything gets scaled down. Movements get small, the voice gets soft, and that's part of that loss of dopamine that occurs as part of the neurodegenerative process. But the good news is there's something you can do about it. And so that's what we do with behavioral treatment versus pharmacological treatment. Is through speech therapy, we train louder voices. That's why the Think Loud. And we do it intensively. So it's an intensive 1-month therapy program that over time really reteaches people with Parkinson's disease how to have a voice that's within normal limits loudness.
Okay. Now, what is LSVT Global?
So LSVT stands for Lee Silverman Voice Treatment, and it was actually named in honor of Mrs. Lee Silverman, who was a woman living with Parkinson's. And it was at her family's expressed wish that Dr. Lorraine Ramig, my colleague, began the work that today is known as the speech treatment. So the company works to translate all of our research science to clinicians who can learn how to do the treatment, and then ultimately to patients who can then receive the treatment. So we have clinicians, over 15,000 clinicians now in 54 countries that we've trained and certified, who then are now out helping people with Parkinson's.
Just working in the community, it's not a clinic per se, it's just within
it's
other...
wherever they work. So clinicians work in either hospital settings, private practice, home health. So they come to us to learn the specialty treatment and then go back to where they deliver their services and help people.
And I'm sure it makes a big difference actually in the sort of the self-esteem or the self-worth of some of these.
A huge impact in that. When you can't communicate, people are constantly say, what did you say? People with Parkinson's begin to withdraw. You know, it's frustrating. And so to be able to give that back to them, not only do they get better speech, but absolutely, they oftentimes say, I feel like my old self. I'm confident I can communicate. We see changes in facial expression, engagement, and participation, which is so important for dealing with a progressive disease that you'll have for many, many years.
Oh, I know that that's an extremely important piece of the puzzle. How does it help speech and movement as far as research and supporting the theory that you guys are involved in?
Sure. So we've had over 25 years of funding from the National Institutes of Health. For the speech therapy program, we've conducted 3 randomized controlled trials. So there's a lot of scientific evidence supporting both the outcomes, and then we've done a lot of work to better understand why the treatment works. What are the special ingredients that make it work? We've done studies of neural imaging and things like that after treatment. More recently, we've applied what we've learned from the speech therapy to the movement, and that's our Think Big or LSVT Big protocol, and that's for physical and occupational therapists. So while the voice gets soft, movements get small. So we retrain bigger movements so that patients can have better functioning. That's also been supported by science, randomized controlled trial documenting improvements in patients after treatment.
And this is the same as far as what you're teaching, all the voice and also the movement in tandem?
They're delivered in 2 separate treatment protocols. So speech therapists deliver the speech therapy, physical or occupational therapists, but many patients receive both, and they absolutely work in tandem. So they learn really kind of one cue. I've got to be bigger, I've got to be louder than I think, just to be within normal limits. But it's exciting because it's something that patients, it's not it's not a medicine, which is important. They have to have that. But beyond that, it's something they learn I can do. I have control over this disease in some way because I've learned these strategies that can help me talk better, help me move better, help me function better in daily life.
Yeah, really giving them back some of the power.
Absolutely.
Which is important.
Absolutely.
Now, why do you participate here? Why does your company
Well, as I
participate?
said, it's one of our favorite events. It's such a well-run event, first of all. Carol Walton and the organization do a fabulous job. And it's so inspiring to come here and see all the families, the patients that come out, the teams that come out, the work they've done for a year to raise money, and for us to get to share our information. Oftentimes we see patients come by our booth who've been through the programs and they get to tell us about their experiences. We pin our buttons on everybody we
Great.
can as they walk around, and so it's a real community event, and it's inspiring for us.
It's inspiring for me
Yeah.
to see you. No, you're lighting up just telling me about what you guys are doing, and it's great to see.
Absolutely.
Cynthia, thank you very much. It was
Thank
a pleasure
you.
to meet you.
Absolutely.
Enjoy the walk.
Thanks.
Good afternoon from Central Park. We're here at the 20th annual Parkinson's Unity Walk. I have the pleasure of joining me here, Rob DeTota from Medtronic. Now, Rob is the senior therapy representative there at Medtronic. Rob, how are you?
Very good. How are you?
Great to have you here.
Thank you.
Thanks so much for your support and all you do for the Parkinson's community. Tell me a little bit about Medtronic DBS therapy and how it actually impacts the Parkinson's community.
Absolutely. Medtronic DBS therapy is deep brain stimulation. It's basically like a brain pacemaker. There's a pacemaker that goes into the chest and some wires that go into the deep parts of the brain, and it provides electrical stimulation, kind of interrupt, the theory behind it is to interrupt the irregular electrical activity that Parkinson's patients experience. And the surgery provides an alternative for patients that are on medication, and it basically allows the patients to come off of some of their medications possibly, and it also helps them improve their quality of life and activities of daily living.
Now, we spoke before. I actually have a friend that has had the DBS procedure done, and it has dramatically increased quality of life. Is every Parkinson's sufferer a candidate?
No, that's something that the doctors are going to have to determine. Movement disorder neurologists, specifically, as well as the neurosurgeons. Each patient is assessed, determine whether they are a candidate or not. There's a lot of reasons why they would or would not be. And as long as the patient is carefully selected and they are deemed a good candidate, they will have a good outcome at the end.
What are some of the qualifications?
Well, first, they should not have any cognitive issues. They should also have on-off fluctuations. Medication starts wearing off a little sooner than it did when they first started. Those are some of the main things. Dyskinesias, tremors, rigidity, bradykinesia are all the signs and symptoms of Parkinson's. As long as they have true idiopathic Parkinson's disease with no cognitive problems, they will move along in the process as far as being selected as a candidate for it.
And what would you say is success rate? I mean, how that works in the process?
Well, that's a good question. It's hard to determine exactly what the success rate is going to be because every center has their own criteria of selecting patients. But the large majority of patients have a great success rate as long as they are carefully selected and good candidates.
Great. Now, why does the Medtronic DBS choose to support here the Parkinson's Alliance Unity Walk?
Well, we've been doing it for many years. Margaret Tuckman has DBS. Since then, we've been working very closely with the Parkinson Unity Walk and the Parkinson's Alliance in educating patients, and that's what we're here to do. We're here to educate patients and support the Parkinson's community.
Great. Now, therapy. When we're talking about therapy in the DBS community, what would you recommend it would be something that would bring along the process in after the surgery? Because like I told you, the person that I know, my friend, just had it activated and has seen a dramatic increase in their quality of life as well as just the meds going down. Is there something you could recommend to him to continue to grow on that success?
Yeah, absolutely. He, stay active, stay within the community, exercise. That's all part of it. When a patient gets implanted and they get their mobility back, their muscles are a little atrophied from years of not using them. To get back out and exercise does a world of good for the patient. So it's important to keep on doing that, and I recommend your friend do the same.
Yeah, I'll let him know. Thanks, Rob.
Absolutely.
Been a pleasure.
Thank you for having me.
Thanks so much for your support, and enjoy the rest of your day here.
Absolutely. Thank you.